Hi, my name is Regina Linbanikid, and I will discuss the standard precaution and transmission-based precaution. Standard precaution are the minimum infection prevention and control practices that must be used at all times for all patients in all situations. Standard precautions include hand hygiene, use of personal protective equipment, respiratory hygiene or cough etiquette, sharp safety, safe injection practices, sterile instruments and devices, and clean and disinfected environmental surfaces. So first is the hand hygiene. It's the most important measure to prevent the spread of infection among patients. Education and training programs should thoroughly address indications and techniques for hand hygiene practices before performing routine and oral surgical procedures. Next is the personal protective equipment. Refers to wearable equipment that is designed to protect patient from exposure to or contact with infectious agent. This includes gloves, face masks, protective eyewear, face shields, and protective clothing. Respiratory hygiene or cough etiquette. Respiratory hygiene or cough etiquette infection prevention measures are designed to limit the transmission of respiratory pathogens spread by droplet or airborne routes. And next is the sharp safety. Most percutaneous injuries examples are needle stick, cut with a sharp object among patients involved, bars, needles, and other sharp instruments. All use disposable syringes and needles, scalpel blades, and other sharp items should be placed in appropriate puncture-resistant containers located close to the area where they are used. Sharp containers should be disposed of according to the state and local regulated medical waste rules. And next is the safe injections practices. Safe injection practices are intended to prevent transmission of infectious diseases between one patient and another, or between a patient and during preparation and administration of parenteral medications. Next, the sterilization and disinfection of patient care items and devices. Instrument processing requires multiple steps using specialized equipment. Each dental practice should have policies and procedure in place for containing, transporting, and handling instrument and equipment that may be contaminated with blood or body fluids. And last is the environmental infection prevention and control. Policies and procedures for routine cleaning and disinfection of environmental surfaces should be included as part of the injection prevention plan. Cleaning removes large numbers of microorganisms from surfaces and always precedes disinfection. Disinfection is generally a less lethal process of microbial inactivation that eliminates a virtually or recognized pathogenic microorganism but not necessarily all microbial forms. And let's proceed to the transmission-based precaution. Transmission-based precautions are for patients who are known or suspected to be infected or colonized with infectious agents, including certain epidemiologically important pathogens which require additional control measures to effectively prevent transmission. There are three types of transmission-based precautions, which include the contact, droplet, and airborne. Contact precautions. Use the following measure in addition to standard precautions when in contact with individuals known or suspected of having diseases spread by direct or indirect contact. Examples include norovirus, rotavirus, draining abscesses, and head lice. And next is the droplet precautions. Droplet precautions are used to prevent the spread of pathogens that are passed through respiratory secretions and do not survive for long in transit. These droplets are relatively large particles that cannot travel through the air very far. They are transmitted through coughing, sneezing, and choking. And the last is the airborne precautions. Use the following measures in addition to standard precautions when in contact with individuals known or suspected to have disease spread by fine particles dispersed by air. Current examples include tuberculosis, measles, and SARS.